Welcome to everyone to the second week of Soul Mental Health Month. Tonight, we're going to talk about, or today, whenever it is you're watching this, we're going to talk about self compassion. Self compassion is a great method to create change. It's a great method in terms of how to live. But certainly, a lot of times, people are looking to create change. I think it's pretty common that most of us want to become more than we are right now. That's a pretty human attribute to think, here I am now, and where can I be in 10 years, and where can I be in 20 years? How can I become more? We are often, I think most people I know want to be better, and they want to be better all the time. And so we're looking at self compassion not only as a useful way to be and a way to be in a way that helps you be more for others, but also in a way to create change, real change that works and that lasts. And so you've probably all done a lot of things to try and get yourself to change. You're using willpower and then you run out. You're pushing yourself to do it. You're beating yourself up when you don't do it. You're, like focusing on you better change, you better change, you have to, have to, have to. And what you find is that it doesn't work. You get burned out, you get frustrated, you get super, super discouraged. And you feel like if people really knew how much of a failure that I was, they wouldn't like me as much, maybe. Or you just deny. You're like, let's just avoid my failure, and I'm just going to eat pizza and watch TV, and that's it. That's the end of my life. So let me introduce you to self-compassion. Self-compassion is a wonderful concept. It's been around, particularly for in the current sense. Okay, that doesn't make any sense. It's been around forever, but we've have this particular way of focusing on it now for the last couple decades that has come about as a change in positive psychology and as a result of some people working in the field and actually creating a lot more information and research about self-compassion. So self-compassion is a thing. It is not about pushing yourself to do something. It's about giving yourself kindness, warmth, love. It's not about giving up on something in order to be nice. And so a lot of times people get confused between, well, what's self-compassion versus what is self-indulgence. And so the example I always give is if it's self-indulgence, if you come home Friday night, you've had a really long, hard week, and you say, oh, I am so tired. I really deserve a huge piece of chocolate cake and a big glass of red wine. That's self-indulgence. That's not self-compassion. Self-compassion is this. It's doing what is in your best interest and not letting yourself off the hook. It's doing what's in your best interest, not letting yourself off the hook. Big fat glass of red wine and a big slice of chocolate cake on a Friday night, not in your best interest. Your body is exhausted, and what you need is something that will help you rejuvenate. Like you need something to eat that's full of nutrition, maybe like a salad, and you need relaxing time and some early to bed. Maybe a salad and a nice warm bath and some soft music and go to bed early. Then you wake up the next day and your body's like, oh, thank you. That was in your best interest. That was, the big chocolate cake, not going to help you rest very well. It might taste great in the moment, but it's not in your best interest. So self-compassion is really a way to feeling more wholeness. It is not a way of letting yourself kind of do a pity party or feel bad or kind of indulge in, oh, things are so terrible. Poor me. That's not self-compassion. It's how to get to change. So you have these feelings when someone else around you is in distress. You might feel empathy for them. That would mean you're feeling the same emotions as the other person. That's empathy. You might feel sympathy. That would mean that you feel concern, sorrow for the other person. You feel bad for them. That's sympathy. Or you might feel care and warmth for the other person, like you just want to envelop them in a hug. That's compassion. What if you felt compassion for yourself? When you're going through a hard time, do you think that you could feel care and warmth for yourself in addition to concern? or really understanding how you're feeling, being able to accept your emotions. And so you could ask yourself a couple questions. Do you treat yourself as kindly as you treat your friends? Do you give yourself support when things go wrong? Do you chew up your friends' tails when they flub things up? Do you chew up your own tail when you flub things up? Is that how it works for you? And look back at this. Is it helpful? Is it working? Is it effective? Is it creating change for you? Unlikely. Unlikely is it creating change. Or if it does, I'm telling you, it's short-term change. You burn out on that stuff. Think about, do you chew your friends out? And versus do you chew yourself out? Is that how it really works for you? So you can look at 3 typical patterns when things tend to go wrong. You might do a lot of self-criticism, or you might kind of punish yourself by self-isolation. Or even if it's not punishment per se, you might think, oh, I'm such a terrible person. Nobody wants to be around me. I listened to somebody who I admire, who I think a lot of, say to other people that when he walks in a room, he feels like everyone in the room already hates him. And I'm thinking, holy cow, how can you possibly feel that way? Like, look at you. Have you not met yourself? You are a delightful person. And so it's very likely that you are the only one who thinks you need to isolate when you do things that go wrong. You're the only one who's that self-absorbed about what you did. Most people don't give it a second thought and they just move right on. You're the one who's stuck. You might be obsessed thinking, oh, people might dislike me. They might be disappointed in me and want to reject me, when really what's happening is the other person might say, I don't even know what you're talking about. What do you mean? I don't want to be around you. I don't even get it. So all of those feelings you might have of shame and guilt and disappointment and anger, you're probably the only one who has those. Other people are very likely much more compassionate toward you than you are to yourself. We beat ourselves up for the very things we have understanding and warmth for in others. We isolate ourselves from our supporters, and we get stuck in a cycle of ruminating or avoiding the thing that caused it. This is Kristen Neff. Dr. Kristen Neff has been doing research in this area of self-compassion for over 20 years now, and she's done some really great stuff. And we're going to look at a questionnaire that she created. Well, this is not actually the whole questionnaire. These are some of the items in that questionnaire. And I want you to just read through them with me and think about them. The idea here is not really to score them, but it is, I want you to think about them and kind of notice which items you think, okay, yeah, I do that. This is a problem for me. And so the first item is I'm disapproving and judgmental about my own, let me move myself here, my own flaws and inadequacies. Or when I'm feeling down, I tend to obsess and fixate on everything that's wrong. When things are going badly for me, I see the difficulties as part of life that everyone goes through. And I'm realizing now as I'm listening to myself, I need to give you more time to think about this, right? So this actually could be a little example of me doing something where I kind of flub it up a little bit and think, oh, here I am like running through this on a list without giving people time to think. That's all right. I got into it, and now I'm going to stop and give you a little moment to think. Disapproving and judgmental about my own flaws and inadequacies. When I'm feeling down, I tend to obsess and fixate on everything that's wrong. When things are going badly for me, do I see those difficulties as part of life that everyone goes through? Or sometimes people get really self-rejecting and they say, other people aren't as bad as me. Other people don't have these same kind of problems. I'm telling you, they do. They do. How about when I think about my inadequacies, it tends to make me feel more separate and cut off from the rest of the world. I try to be loving toward myself when I'm feeling emotional pain. How do you do with that one? When I fail at something important to me, do you become consumed with feelings of inadequacy? When you're down and out, I remind myself that there are lots of other people in the world feeling like I am. Do you recognize that other people struggle, and when they're bummed out, they also, you and they, we're all connecting in that way. When times are really difficult, I tend to be tough on myself. Like, get up, keep walking. You can't have a difficult time. You have to keep going at it. Push, push, push. Is that you? Or when something upsets you, do you try to keep your emotions in balance? Or is it like you try to just like get rid of your emotions and just move on? Or you just think, oh, you just better be more successful? Or do you allow yourself to have disappointment and allow yourself to think, okay, this was tough. This is hard. How can I love myself? How can I support myself? And this last one, when I feel inadequate in some way, I try to remind myself that feelings of inadequacy are shared by most people. I don't know a single person who doesn't feel inadequate at times, or a lot of times even. What I like to remind myself, and I was actually just sharing this with somebody yesterday, is this idea that when you feel inadequate, you can say, okay, fine, I'm allowed to feel inadequate. But feeling inadequate is not the same thing as actually being inadequate. And so you could say, all right, so I feel inadequate, or I feel like I'm not good enough to do this. I'm just going to go off and do it anyway. If you need me to bring you a hammer, and I'm like, oh my gosh, I'm so inadequate, I can't bring you a hammer. But I think, well, I'm just going to bring it anyway. I can pick up a hammer and bring it to you. And that's adequate, even if I don't feel adequate. So feeling inadequate is usually not very useful as a measure of how you really are. You probably are just plain good enough. And so think about what your typical pattern is in terms of self-compassion. If you want to know more, you can go to selfcompassion.org. Great website. There are on selfcompassion.org, there are some guided imagery or guided meditations that you can do that are really useful. And so take a look at that. All right. So what is self-compassion? It is doing what's in your own best interest and not letting yourself off the hook in a gentle and firm way. Being supportive, being cheerleading, being motivating, being loving, being kind, being patient. Self-compassion is not self-indulgence. It's not selfishness. It's not forcing yourself. It's not being willful to yourself or being harsh. It's none of those things. And in fact, what happens is when you do those things, especially forcing yourself, being willful or being harsh, what happens is you end up more discouraged than you would be if you weren't doing those things. You burn out. And in fact, you end up eroding your own motivation. And so when you feel not very motivated and you feel like you want to just give up, a lot of the times it might be because you've been willfully forcing yourself or you've been really harsh on yourself. So it involves three things: being kind and caring, seeing imperfection as part of being human, and noticing reality clearly. So you're not exaggerating. You're not saying, oh, I'm always doing things this way, or I can never stop, whatever this is. You're noticing reality. Sometimes we don't face reality very well. This is my sister. I asked her to take these pictures some years ago, and I've been using them ever since. They're awesome pictures because sometimes reality is sort of like you're riding a horse and you're facing the wrong direction. And so it's like the horse keeps going there, but you refuse to look in the direction the horse is going. Instead, you're looking at your past. You're looking at the past and all the things that might have happened in the past, and you're refusing to look forward where you're going. And so I had her take a picture of her on her horse facing the wrong way and being willful, and her kind horse put up with it. It even put up with her standing on her horse. This is another one of my favorite cartoons, Garfield. And you can see he's looking over the table and he steals Odie's lunch and he steals John's lunch and he says, "You can't stop what you don't see." And then you see that he is stopped because reality is a thing. We should notice it. So accepting reality is like turning around in the saddle and facing the direction your horse is already going. That's accepting reality. It's saying yes. Some people think if they're still hard on themselves, then they're more likely to take action. And they might say things like, I just have to get over it. I'm just being lazy. But what we know about this is it just increases anxiety over time. And so if you haven't figured out yet that this just creates anxiety and erodes your motivation, you'll notice that in the future. So my suggestion is stop now. I mean, you could wait until the future. There's nothing wrong with that. It's just, painful. So why would you sign up for that? So this kind of response will increase your anxiety, lessens your motivation, it increases your hopelessness. Immediate action is not worth it. Having self-compassion is not about not doing the things. It's about doing what's in your own best interest and learning how to do that. A lot of times, self-compassion is about doing the things like making your bed or doing the dishes because those are in your best interest. And it feels better to take care of yourself in a kind way. If you were taking care of somebody who came to visit you, you would probably do things like bring them a towel or make sure their bedding was washed or wash the dishes or make them breakfast. What if you did that for yourself in the same loving, kind, supportive, and warm manner? Okay, so on this slide, what you see are 3 ways in which your brain is pretty good at activating. And so you can have an area of activation that happens to help you achieve. And so here we have emotions that work toward achievement. You want, you're pursuing, you're achieving. And then there's an area of your emotions that really activates with threat. And so you're seeking safety and you're seeking protection. And so the first one, you're seeking achievement. The second thing, you're seeking threat. This third one, called soothing, is where you're not actually seeking. You're non-wanting. You're not seeking anything. You are just safe. You're focusing on safeness, kindness, being affiliative or being connecting to others in a non-wanting way. And that's a very soothing way. When you see yourself as having these kind of 3 categories to your emotions, you can start seeing that soothing might not happen very much. And so what if you focused on creating more soothing in your life? Soothing where you're just able to accept yourself and be with yourself in kind of a safe, non-wanting, just gentle, warm way. When your body grows up with compassion, and compassion is sort of your life, it's the way that you have learned to be in the world. So these are people that don't grow up in trauma, but they grow up in good, kind homes. Then what you received is kindness, gentleness, warmth, compassion. And so then your whole brain is sort of finds it like normal and natural to see that the world is a safe place. Your immune system is improved. People are helpful. You kind of assume that people will be helpful. You don't assume that they're going to hate you. Your first assumption is that they will help you. Your stress hormones are reduced. You feel soothed. You have better sleep. You're more resilient. That's what happens if you kind of grew up in this compassion received place. If, however, you grew up in a place where you felt a lot of threat, in a threatening environment, traumatic sometimes, doesn't always have to have the typical kinds of trauma, but just, neglect, a threatening environment in general growing up, then what your brain learns is that the world is not safe. And you have a higher level of cortisol. You think people are dangerous. You worry about other people's kindness. It's hard for people to give you kindness without you feeling threatened and anxious and upset about it. You're hypervigilant. That is normal. That's normal for when you grew up that way. If you grew up in a threatening environment, this is what your brain does to protect you. And so kind of take a look at that and you think about which way you feel like you are more likely to have grown up. And then what you're doing is you're going to recognize that if you feel threatened easily, or if you feel the kinds of things on this slide where the world's not really a safe place, it's hard for you to accept people being kind without worrying. If that's where you are, you can develop more resilience. You can develop a safer brain by practicing self-compassion. It might not be the only thing you need to do to recover from this, but it is certainly one of the most important things that you can do is develop a sense of self-compassion. Self-compassion is not a feeling that just lands on you. It's not a feeling that just comes out of the blue and lands on you. Self-compassion is the result of a lot of work, a lot of action, and a lot of choosing. So you're choosing to have compassionate, kind thoughts. You're turning the mind away from those harsh thoughts. And what we know is that people with self-compassion can handle stress better. They recover faster. They become more resilient. And you can create this change where you become more resilient by developing self-compassion. When you use criticism and threats to get what you want from yourself, you burn out. Self-compassion will create more motivation. So you just have to, like I said, you have to practice it long enough for your brain to really recognize, okay, things really are going to be different now. I don't have to face the self-criticism all the time and have all of that sense of cortisol is happening because I'm doing so much self-criticism. So the next time that you get ready to take a little bite out of your own tail, remember, this is not effective behavior. So stop the self-criticism. Sometimes I'll suggest to people that if you criticize yourself, I need you to give me 10 push-ups or 5 push-ups, or, depending on who you are, maybe it's 50 push-ups, right? However many push-ups is enough to be hard to kind of remember, so you can think, oh, I really want to stop that because I'm sick of doing push-ups today. So you notice reality in a kind way. Turn your mind attention to soothing content. Now, it may be that you have a hard time doing that, and there's nothing wrong with that. That might be where you are right now. This is a gradual, gentle movement. You're going to be patient with yourself and patient with the content of your thoughts. But the idea is you turn away from that harshness, try to feel soothing feelings more often, and give yourself more of a sense of connection to what is good and what is happy, and less of a connection, turning the mind over and over away from being angry at yourself. Instead, what can you do that will be in your best interest? Usually I think about a thing where I'll say, all right, I'm having a hard time today. What are 3 things I can do that are in my best interest? And they might be something like go drink a big glass of water, or go take some supplements that are good for you, do something for my body that's good for me. And then maybe I'll think, go do 7 minutes of dancing in my living room. That works really well. And that's pretty easy. Most everyone can do 7 minutes of dancing in your living room. You just find some music that you have to move to, the kind that you just can't not move to unless you're dead, right? Find some of that, go stay in the living room and start just doing a little dance. Or you could think, maybe what I really need right now is to just make my bed. Sometimes making your bed makes the world better because it feels more ordered. Maybe that works for you. Maybe it doesn't work for you. Figure out what are the 3 things that you could do today, or what are the 3 things you could do each day that would give you a sense of, I love myself, I'm kind, I am caring for myself. This is the kind of thing that I would do for my own guest. Work on creating that sense of compassion. When you have a hard time with your emotions, or you're having a rough time, or you're in pain for some reason, be kind, gentle, and supportive. Lose the harshness. Sometimes visuals, music and visuals can really affect your mood. And so I'm going to show you a few. These, of course, are from my life, but I think that they're infectious and might make you feel a little bit of a smile. I love that one to finish on. You're open to the world and you're saying yes. So have a lovely week and try and exercise that self-compassion and be compassionate with yourself as you learn this new skill. Take care.